Tonight, a new perspective on circumcision, a practice cloaked for centuries in social, religious, and medical significance. Some are now describing it as mutilation, others as illegal.
I have to make it so he doesn't move.
It happens every minute of every day. Newborn baby boys like little Michael are circumcised.
When you're born in this world, your body is your birthright.
I get letters constantly. I get phone calls constantly.
Jim Bigelow is a psychologist and former minister who's written a book questioning circumcision. A practice, Bigelow says, that, like this old phonograph recording, should be relegated to history.
The male foreskin is the only human organ that any medical profession allows a surgeon to remove when it is perfectly healthy, when it is perfectly normal, and when it is functioning perfectly.
So I think the anger stems from the idiocy of the whole thing. Why do it? There is no good reason to do it.
And that's what these men are asking.
And a lot of men are feeling mutilated. More and more men are feeling mutilated.
This group meets each month in Montreal.
When I was a baby and I'm not able to decide, I think it takes a part of me without my authorization.
The main consideration for me is that I've been deprived of this sensitivity throughout the whole of my life. What for?
In fact, historically, the foreskin was removed to desensitize the head of the penis and reduce sexual pleasure. That's why it was done to the slaves in Roman times. And that's why it enjoyed a resurgence in the 1800s, promoted across North America as a treatment for insanity, epilepsy, and to control masturbation. A key proponent was John Harvey Kellogg of Cornflakes fame. He wrote that circumcision, particularly when done without anesthetic, has a healthy effect on the mind, especially if it's connected with the idea of punishment. The practice continues today, according to Jim Bigelow, largely because circumcised men simply want their sons to look like them.
When I wrote a part of my book where I had to deal with the statistics of what we're doing today, every day in the hospitals, I can remember weeping. I think, oh my God, what have we done? And what are we continuing to do?
Over the last 2 years, several medical associations, including the Canadian Pediatric Society, have issued statements discouraging the use of routine infant circumcision. The reason why? There has been mounting scientific evidence suggesting there are few, if any, health benefits to the child.
Yes, I think it's time that we stop this procedure.
David Olwyn is a Montreal area physician and a member of Doctors Opposing Circumcision. He's reviewed the latest scientific research and has found considerable evidence against circumcision.
As physicians, we really don't have good reason to continue this practice.
Studies that show circumcising without anesthetic, a still common practice, makes babies more sensitive to pain later in life. Studies that show the procedure does not prevent hospitalizations due to severe urinary tract infections. And studies that show circumcision offers minimal protection against cancer of the penis later in adulthood. And then a little-known but important Canadian study by Dr. John Taylor in Winnipeg, who looked at the foreskin under the microscope. He found highly sensitive cells, cells like those in our fingertips and lips, vital erogenous tissue that's being cut and thrown away.
That's not good.
With so much contrary evidence, David Olwyn says doctors who continue performing circumcisions are violating a professional code which prohibits unnecessary medical procedures.
So all these doctors who are doing circumcisions,
they're doing so unethically.
Are you saying that doctors who perform circumcisions are unethical?
Yes.
Keep that in his mouth.
Dr. Neil Pollack performs about 1,000 circumcisions each year. Dr. Pollack says he believes circumcision still offers several benefits. He'll argue that it can reduce the number of urinary tract infections, decrease the incidence of penile cancer, and reduce the risk of AIDS. It's all, he says, in how you interpret the scientific data.
I'm angry at the fact that people are willing to do something so drastic with so little information.
But what's more, circumcision may in fact already be illegal under the Canadian Criminal Code.
what you've got is an intervention on a child without the child's consent for a non-therapeutic purpose.
Margaret Somerville is a lawyer who studies medical ethics at McGill University in Montreal. She said that if there are no clear benefits to circumcision, no one, not even parents, can consent to a non-therapeutic procedure.
And I think most of them would be shocked to think that they were contravening the criminal code. But I believe that in fact they are. So it's a question of whether we would want to activate that law and actually apply it rather than just having it there on the books.
In fact, she was drawn into the debate because of an uncomfortable parallel with female circumcision, where parts of a girl's genitals are cut off. That's prohibited in Canada. Should the same apply to boys?
Maybe something we've been doing isn't ethical. We should step back and rethink it.
The growing evidence against infant circumcision is in fact challenging its religious practice, a practice rooted in centuries of tradition among Muslims and among those of the Jewish faith.
What's wrong with it is we didn't realize what we were doing for all these thousands of years, and that's what's changing now is we're learning new information, we're discovering that this is harmful.
Ronald Goldman is a psychologist and author of a newly published book, Questioning Circumcision, a Jewish Perspective.
There's a growing recognition of respecting what the child would want. Circumcision is not something in the Jewish community that we volunteer for to do on ourselves. This is something that is forced on a baby.
In Wayne Hampton's opinion, there is no justification, religious or otherwise, for circumcision. And what's more, Wayne can now say that he knows the difference. He's one of a small but growing number of men who have restored their foreskins, a process based on a book called The Joy of Uncircumcising, written by psychologist Jim Bigelow.
More and more as men learn that they really do have an option, that something can be done, then we expect to hear from thousands and thousands of more of men who never thought it would do any good to complain.
Get enough foam to make a set in several sizes.
It's non-surgical and involves stretching the skin over the head of the penis using tapes and elastics.
Slow process, I can tell you that.
And at the men's support group in Montreal, they discuss not only the effects of circumcision, but the technical points and the benefits of foreskin restoration.
There's been a marked increase in sensitivity, very, very marked.
It's for the sensitivity too.
I couldn't begin to tell you the number of men who write to say, for the first time in my life, I stand in front of a mirror, or I go to the Y, or to the gym, and I feel normal. I feel whole.
There are switches here.
It took Wayne Hampton over 3 years to restore his foreskin. He and his wife Catherine say it's made a big difference to his self-esteem and to their love life. Not surprisingly, Wayne and Catherine chose not to circumcise their son and are urging other parents to do the same, to allow the next generation of boys the right to make this important decision on their own.